Hi, Magic. It's great to see you.
It's good to see you again, too.
How are things going?
I'm good.
Good. There's something I wanted to talk about today that we haven't talked about before, and that is I'm wondering if you're interested or thinking about having a baby or a family.
A baby? That's a good question. I haven't had that question asked to me before, but I'm not saying that I wouldn't want to. If I can go by the proper procedures of having a healthy baby, then I definitely will.
Oh, great. Okay. Yeah, definitely. You have every opportunity to have a baby who is born healthy and without HIV, and we can talk about that some more. Yeah.
Okay.
There's lots of things we could talk about, and you're already doing the one thing that's most important, which is taking medicine to keep your HIV viral load undetectable. So that's the most important thing. You have an undetectable viral load. It's really important to prevent you from sharing HIV with your wife. But there's also something that she could do to help protect herself from getting HIV. So that we call PrEP, or pre-exposure prophylaxis. Have you ever heard of that?
I've never heard of that.
So that's when a person who's HIV negative takes a pill every day, and that offers them some protection of getting HIV. So the pill that's approved for this in the United States is called Truvada. Truvada. So you might have heard of that in terms of it's used for treating HIV along with other medications. So some people with HIV take Truvada, but always with other medications to treat HIV. But the studies have shown that it's also by itself, that one pill, helps to protect people from getting HIV.
So you take one pill?
You take one pill every day.
Every day, and that's it?
Yeah.
Okay.
And it usually takes a few weeks for that protection to start. And depending on the person, we want to make sure that they get tested for HIV before they start taking it.
Oh, okay.
But this is something that either you could talk about with your wife, or I'd be happy to talk with her about it. There's lots of resources about that PrEP. So that's just something I wanted to let you know about. That's another option for people who are trying to get pregnant.
Okay. We're not too quick to have them right now. We just, like I said, we're trying to go through the proper procedures and doing what we're supposed to do to make sure that we have a healthy baby, because I am positive and she's not. So
Okay.
we got to go through the proper protocol for that.
Okay, great. So in your case, like I said, having an undetectable viral load is really important, both so that your wife doesn't get HIV from you. So the fact that your viral load is undetectable really lowers the risk of you sharing HIV with her to a very, very low, maybe a level of 0, as long as your viral load is always undetectable. And as long as she stays HIV negative, if she becomes pregnant, as long as your wife is HIV negative, then the baby will be born without HIV, HIV negative as well. So that's a really, I think, important point about it. There's definitely other ways, other procedures, other things that we can talk about to help you have a healthy pregnancy and a healthy baby. And if you're interested, I would love to have that conversation with you and your wife, or if you have questions you wanted to ask before we bring your wife in, that would be fine too.
Okay.
What do you think?
Well, right now it's kind of weird of me talking about having a baby. The simple fact is because I never thought I would be even thinking about having a baby after my diagnosis. But now that you're asking me that, it kind of brings a little bit of hope, because I thought that, it wouldn't be a good idea to bring a baby into this world, especially if it's not healthy. But since you're telling me that, it is possible to have a healthy baby, I would love to bring one. I would love to have one, Like I said, my wife, we talked about it, we thought about it, but we never really reacted on the proper protocols to have the baby. So now talking to you has just made me feel a little bit better, and maybe a little later we can talk to my wife together and we all can have a conversation, because she's unaware that she can have a baby too. So I think it'd be a learning experience for both of us.
Okay.
So I think maybe we should talk to her later,
Okay.
and all three of us can discuss the protocols to have a healthy baby.
I'd be happy to do that. And whether, I think I have some time on my schedule later today, we could talk about it, or we could schedule another visit and you
Perfect.
could both come in to talk
Either
about
way.
it. Okay.
Mhm.
Great.